What we have here are images from an fMRI of a study in which patients were asked to watch sad films. And these sad movie clips led to to changes in different parts of the brain. And then we compared people who had had training in mindfulness with people who are essentially novices. They'd never had any training in mindfulness. And so what we see is that the red and orange areas are parts of the brain that are very active, and the blue areas are parts of the brain that are less active. And the specific areas of the brain that are active are telling us how is the brain managing to make sense of this emotion of sadness, and what is it doing with it. And so what you see here is when people are sad, this is collapsing across both people with mindfulness and without any mindfulness experience. When people are sad, the brain, in a sense, sends off a bit of an alarm signal. The medial prefrontal cortex is an area where people evaluate information based on its meaning to them. The posterior cingulate is an area that is involved with judging information as good or bad, relevant to the self or not relevant to the self. The insula is a region in which, and both of these areas are very active. So people are feeling sad and they're asking themselves, is this a good thing? Is it a bad thing? And also, what should I do about this? How can I handle this? In the insula, there's a decrease of activation. And the insula is one of those areas where people are aware of their bodies. So they're relatively less aware, they're tuning less into their bodies, and the ventrolateral prefrontal cortex is also involved with attention to the external world, orienting oneself. So in a general way, what you find when people are sad is that their minds are very active. What should I do about this emotion? How can I get rid of it? Is it good? Is it bad? And they're moving away from the present moment, if you will. Present moment based on attention defining your position and also current information from what the body is doing. Now, once people have had training in mindfulness, you actually see that there are very interesting differences. The regions that involve asking oneself questions about the self, is this good for me, is this bad for me, these regions are less active, so that these parts of the brain are being used to reduce the interpretation of sadness, and the insula becomes more active, so people are able to draw on information from the body. The ventrolateral prefrontal cortex also increases, so this now becomes a little bit redder instead of blue, which means that attention is available to help the person locate themselves in the present moment. And so what we find is that it's not a complete reversal where this becomes blue and this becomes red, but people with mindfulness are able to downplay some of the intensive evaluation and judgment that goes on around the self and bring to mind a little bit more about present moment experience. And we think that what this does is it kind of opens up the number of options that people have for understanding how they can respond to the sadness. Instead of it being something bad that they have to get rid of, they can perhaps watch it and observe the effects of it in the body, observe the effects of it in terms of their attention. And this may help them choose more wisely around what to do when sadness appears.